declared dead by a doctor when you're still alive. Look, everyone makes mistakes. That's only human. But it's a lot easier to accept, say, a restaurant screwing up a pizza order than a surgeon removing the wrong limb or a nurse injecting a patient with soup. Yeah, soup. Let's take a look at some of the worst mistakes that have ever occurred in hospitals, so perhaps you can try to avoid some of the obscure issues in our healthcare system. Huge thanks to Grammarly for sponsoring this video. In 2012, Enrique Ruiz went into a New York City hospital to get a breathing tube inserted, a routine procedure called a tracheotomy. He'd been using a temporary tube for a lung condition and needed it replaced. But as he lay unconscious on the operating table, he caught on fire! The source of that inferno was an electric scalpel known as an electrocautery tool that the doctor was using to cut. It began sparking and ignited his oxygen tank. He was fortunate, however, to escape his traumatizing procedure with only second-degree burns. Are there other recorded cases of surgeries ending in flames? Unfortunately, yeah. Over a 20-year period from 2000 to 2020, 565 surgical fires were reported to the FDA. Most happened because the environments were present with more than normal levels of oxygen. In 2009, a German man named Dirk went in for a routine prostate cancer surgery. It was supposed to be a run-of-the-mill procedure, but afterwards he started having intense pain, fatigue, fevers, and his wounds wouldn't heal properly. But his doctors told him not to worry, it was all part of his recovery. But a couple of weeks later, a home health aide noticed something that definitely wasn't normal. A gauze pad was coming out of Dirk's stitches, and that was just the tip of the not-so-normal iceberg. Scans revealed that 16 items had been left inside his body during the surgery. Swabs, a roll of bandage, a part of a surgical mask, needles, and other medical tools. What in the world happened during this surgery? Did the anesthesiologist mistakenly put the surgical team to sleep? I don't mean to laugh, but this is extreme. It took 2 more operations to get all the objects out, but fortunately he did survive the procedure. Objects being left inside patients is one of the most common never events, or a mistake that should never have happened in the first place, and surgical sponges are usually the most common item left behind. But usually we're talking about one object, not 16. And we actually do a count before and after, sometimes even having a flow chart of every object that went into the surgical field and returned. In 2012, an 88-year-old Brazilian woman named Ilda died 12 hours after being injected with soup. She was in the hospital because of a stroke that left her partially paralyzed. The soup was supposed to go into her feeding tube, but a nurse accidentally put it into an IV in her right arm instead. Ilda's daughter saw it all go down and said that her mother started to squirm and stick out her tongue as soon as the soup entered her vein. Death caused by an incorrectly used medical device is another type of never event, and so is death associated with a medication error. Terrible that both happened in this case. While the hospital admitted to the mistake happening, they argued it wasn't lethal. But Ilda's official cause of death was listed as a pulmonary embolism. This actually supports the claim that the soup injection killed her, given that injecting non-sterile and large particles of soup can lead to clot formation, especially in smaller blood vessels in the lungs. One night in 2014, Michael Cleveland went into cardiac arrest while he was grocery shopping. He was rushed to the hospital where he was pronounced dead an hour later. When his wife Tammy viewed his body the next day, he seemed less dead than she was expecting. Tammy claimed he was following her with his eyes, moving his legs a little, and that he tried to hug her. He kept showing signs of life over the next few hours, she said, so Tammy asked the doctor to check if her husband was really dead. She claimed the doctor basically ignored her request. He didn't perform any kind of exam or even touch his body. The doctor said Michael was still moving because he had a lot of life to expel out of his body. When a coroner came to take Michael's body away, he instantly called for a nurse because dead people don't move. The doctor examined him and surprise, surprise, found a pulse. Michael was still alive. He was transferred to another hospital where doctors tried to open a blocked artery to save his life. Unfortunately, he died the next day, for real this time. In a negligence lawsuit brought against the doctors who prematurely declared him dead, his family argued that he could have lived if he'd undergone heart surgery a few hours sooner. The hospital argued that he would have died anyway and the delayed treatment didn't make a difference. A judge also ruled that Tammy's emotional stress couldn't be measured because she didn't seek therapy after the incident. You know, sometimes I can't tell whether our healthcare system or legal system is more messed up. In 2021, a surgeon in Austria amputated a patient's right leg. The operation went off without a hitch, except for the fact that while they may have operated on the right leg, It was not the correct leg. They were supposed to amputate the left one. He ultimately wound up getting both amputated. The limb mix-up happened because the surgeon had marked the wrong leg for amputation before operating. In court, the surgeon actually said she didn't know why she'd done it and described the error as a flaw in the chain of command in the operating theater. The surgeon was slapped with a fine and got moved to a different clinic. Sadly, the patient died for an unrelated reason before a court decision was ruled, so their widow was awarded only about $5,000 in damages. While amputation errors are rare, they do happen every now and then. Actually, back in 1995, a US doctor discovered in the middle of a surgery that he was amputating the wrong foot of a diabetic patient. But he had to keep going because he already cut through muscles, tendons, and ligaments. A nurse pointed out the mistake after rereading the patient's medical records, but it was too late. That's why we have pre-surgical checklists that the patient needs to be awake for, the nurse needs to be present for, and the doctor, so everyone can get on the same page. Back to the mistakes in just a second, but first I want to tell you how I avoid mistakes thanks to Grammarly, an AI writing partner that works seamlessly with your everyday apps and helps professionals write better and faster so they can get their work done. I send so many emails to my team, and Grammarly comes in handy, making the process so efficient. One feature I love is called Quick Fix. That actually comes with the free version of Grammarly. It polishes my writing as I go, helping me stay in the flow. With the press of a single button, I can accept the suggestions all at once, so clutch. Grammarly Pro comes with even more features too, like sidebars, which give me a one-click paragraph level rewrites, and if there are some words I don't like, I just click them away, which keeps my writing personalized and tailored to my writing style. 96% of Grammarly users report Grammarly helps them craft more impactful writing, so sign up for Grammarly free and upgrade to Pro if you want to take your productivity to the next level. And now that you know how to avoid mistakes with your writing, let's see how we can avoid mistakes with our healthcare. Strap in because this one is nightmare fuel. In 2007, Erin Cook went under general anesthesia for surgery to remove an ovarian tumor. About halfway through her 3-hour operation, she suddenly woke up in excruciating pain. She could feel the surgeon cutting into her. Although she was fully conscious, her muscles were still paralyzed from the anesthesia, so she couldn't move or speak. That meant she could feel everything, and yet there was nothing she could do about it. Over and over, as she later explained in an interview, Erin tried to move her finger to spell out the word help. It didn't work. Then she tried to stop breathing temporarily because she thought that might trigger an alarm and someone would realize she was awake. Nope, the doctors were behaving like everything was normal. As it turns out, the doctors hadn't noticed a leak in a device called a vaporizer that turns liquid anesthesia into gas and delivers it to patients in a controlled, steady dose. Erin received only 5% of the total amount of anesthesia needed to keep her sedated throughout the entire operation. But she got all of the paralyzing chemical giving alongside the anesthesia to keep her body still. The traumatic experience took a psychological toll on poor Erin, who couldn't sleep for more than 15 minutes at a time for the next 2 months. The following time she had to get a surgery, she asked for local anesthesia, not general, so that she'd be awake and could communicate if anything went wrong. Joseph Dudley showed up to an Iowa urgent care center in 2017 with disorientation, a fever of 103, an abnormally high heart rate, and rapid breathing. Even though he tested negative for the flu, a physician assistant diagnosed him with it anyway and sent him home with Tamiflu. He was so dizzy he had to leave the clinic in a wheelchair. A few days later, Joe still wasn't feeling any better. He went to the ER where he was accurately diagnosed with bacterial meningitis, a life-threatening infection of the membranes covering the brain and spinal cord. He was admitted to the ICU and placed in a medically induced coma to minimize damage. But he had already suffered 3 strokes, which caused permanent hearing loss in one ear, brain, and nerve damage. He sued the urgent care center and was awarded $27 million. In 1985, a newspaper photographer named Bob East went in for a surgery to remove a cancerous eye, which was planned on being used for research. Toward the end of his 8-hour operation, a doctor accidentally took a vial of formaldehyde-like solution, which was supposed to be used to preserve his eye after it was removed, and injected it into his spine. He was then quickly declared brain dead. The problem started when the vial of formaldehyde-like solution was brought into the OR by an ophthalmology resident without it first being labeled. Then a communication mix-up resulted in a nurse mislabeling that vial as CSF, or cerebrospinal fluid, which was removed but was supposed to go back into Bob's spine. However, thanks to yet another communication mishap, both a vial of the real CSF and the preserving solution were both injected into the spine. His blood pressure instantly plummeted and his pulse slowed down. Life-saving measures were administered to try and help him breathe, but they didn't work. No one on their surgical team actually understood what was even going on. It was only until about an hour later that the ophthalmology resident who'd brought in that lethal vial of the solution came back and asked where it was. The surgical team quickly realized their mistake and accepted full blame for the accident. Speaking of amputations, a bus driver in India had to get his leg amputated in 2018 after losing it in an accident. When his family came to see him in the hospital, they found him lying on a stretcher on top of his own leg. His amputated limb was being used as a pillow to prop up his head. His family members asked the doctors to go get a normal pillow, but no one did. Eventually, one relative went out themselves and bought a pillow for the poor guy before his family transferred him to a different private hospital. Oddly enough, the doctors and nurses involved in the decision defended it, saying they used his severed leg in order to give him immediate medical care. So did they get a gold star for their quick thinking? Not quite. They were suspended from work, and rightfully so. In 2017, a 17-year-old boy broke his leg playing indoor soccer in Minnesota. He went to the hospital and got surgery the same night. The next day, however, he reported severe pain, numbness, and burning in the lower part of his leg. Despite that, he was sent home anyway. After 6 days, he was still in excruciating pain, so he went back to the hospital and got a second operation. A different surgeon performed it and diagnosed him with acute compartment syndrome. It's a serious condition where pressure is building up inside a muscle, leading to tissue damage. In the lower portion of his legs, the muscles were gray and couldn't even contract. That's because during a